Every single person out here says they like it and they want to continue it. It's in place right now. What this bill does is takes the good program we have right now pursuant to executive order and makes it a great program pursuant to law. We've raised the standards to make sure that PCAs, before they can get on the floor, have the exact same minimum criteria that a CNA in a classroom setting has. There's no distinction, none whatsoever. We've kept it so that the PCA program, you can only do it once, period, for a 4-year period of time. You can't hop from facility to facility. We've addressed every single issue that's been brought forward to concerns quality of care.
My name is Kim Warnicki. I work for Gulf Coast Healthcare. I'm the Chief People Officer. On average, any center in the state of Florida, not just Gulf Coast Healthcare, has 10 open CNA positions. This continues to be one of the hardest positions, not only to recruit, but to retain. The PCA program started with the rule with the pandemic, and we've had it in place ever since, promoting it hugely, if that's the right way to say it, in our centers, because we feel that this is absolutely our pipeline for staff to become CNAs, and then eventually a lot of our CNAs want to progress further into some sort of nurse, LPN, or RN program. And once the pandemic hit, we had staff that quit on the spot. We had individuals calling out sick, some out longer than others depending on signs and symptoms, and then the CNA testing sites closed, so individuals that were prepared to take the exam and be a certified nursing assistant were unable to. They just have such a passion, I guess, which is I think what the most fun is. I had one of the directors of operations say how cool the PCA program was because he saw people having fun again. He saw people enjoying their job again. And CNAs that have worked for a while, and especially the CNAs that were at the height of the pandemic, saw the PCA program as a lifeline for them because they were working overtime and double shifts and they were tired. And then you have the PCA program and you have these individuals that are fresh, new as life, coming into the business and just really wanted to make a difference, had something to offer, and what they had to offer for everybody was hope.
Okay. My name is Rashawn Van Vliet. I work at Gulf Coast Healthcare for Bayside Health and Rehab. I was a PCA and I am now a CNA. I got my CNA within 2 months of doing the PCA program. And this is my little guy, Braxton. He wanted to join. I learned last August about the PCA program, and I wanted to get a better opportunity for my little boy and I. So I did take the leap of faith to do it. I have a lot of nurses and CNAs in my family. It gave me a chance to earn a paycheck and learn about about being a CNA. I needed the job to support my son and I. Like the guy had stated earlier, I am a single mom, so it does help. And I think the PCA program has helped me a lot because it's more hands-on. And I don't do good in school settings. I can't sit in a classroom. I give my little sisters props because they both did it. I just couldn't do it. So then when I found out about Bayside had the PCA program, I thought it was a good opportunity to do it. And it's helped me a lot with him. It's a good career to have, and I'm hoping to become a nurse actually one day. I had a really sweet resident. Fortunately, she has passed on. She impacted me a lot because anytime she'd see me, she would tell me she loves me and that she appreciates all the help that I was giving her, and told me that I was going to make a good nurse one day.
Senators, we're going to roll out a health budget, and it's going to have major reductions, and we're doing everything we possibly can not to have reductions to nursing home rates or staff, because that industry is struggling right now. So this is a win-win on so many levels of giving people opportunity, but giving our seniors somebody there to care for them.